In this lecture, we will discuss the intrinsicoid deflection, specifically what it represents and how it normally appears on the EKG. The intrinsicoid deflection is the time from the onset of the QRS complex, that is the earliest Q wave or R wave, to the peak of the R wave. So if you look here, this is our intrinsicoid deflection. Notice it's from the beginning of our QRS complex, this point here, to the peak of our R wave. So this is our R wave. Remember, the R wave is the first positive deflection after our P wave. This is our T wave here, okay? And again, the intrinsicoid deflection from the beginning, okay? Our first wave here is an R wave. If it was a Q wave, it would be like this, but still it's from the beginning of the QRS to the peak, that top point, right before it starts to go negative or starts to go downward in the R wave. That's where what we call our intrinsicoid deflection. It represents the transmission of the impulse from the Purkinje network in the endocardium to the epicardium surface directly under the electrode, okay? So again, we're going from, let's review our conduction system. This is our sinus node, our internodal pathways here. The three of them, right? The anterior, middle, and posterior. Our Bachmann bundle that comes here to the left side. We have our AV node at this point. This is our His bundle. Then we have, after that, our right bundle branch over here on the right side, innervating the right ventricle. Then we have our left bundle branch, and then we have a left anterior fascicle and a left posterior fascicle. Okay, and then right from these fascicles and the right bundle branch, we then have these Purkinje fibers, okay, that come off. You can sometimes see these branches. Then they innervate the myocardial cells, okay. And what we're saying is, from that point on, now if you come here we're at our Purkinje system, where the intrinsicoid deflection is all this. From that point, our Purkinje system in the endocardium to the epicardium, right to directly under the electrode surface, okay. So imagine we're going from the Purkinje system, then we have that inner layer of the heart, the endocardium, to the outer layer of the heart, the epicardium, to our electrode directly under the surface. And why we call this an intrinsicoid and not the intrinsic deflection is because we're measuring it on the surface EKG. If we measured it inside the heart, it'd be intrinsic, okay? But this is outside, so this is called the intrinsicoid deflection. Now, there have been some upper limits that have been set for what's considered normal duration in the right and left precordial leads for the intrinsicoid deflection duration. In the right precordial leads, V1 and V2, normal is considered less than 35 milliseconds, while the upper limit of normal in the left precordial leads, V5 and V6, is 45 milliseconds, okay? So 10 millisecond difference. So why is it that it's greater in the left precordial leads? Well, this is because the left ventricle is thicker than the right ventricle, and therefore it takes longer for the impulse to make it through that thicker left ventricle wall. All right, so again, because we're saying it's going from the endocardium to the epicardium, right? Imagine this left ventricle has a thicker wall, okay, a thicker wall than the right ventricle, so it has more wall to traverse, to get through, to pass through, and because of that you see that difference, okay? And here in the left precordial leads, all right, over the left side of the heart, the left ventricle, it's 45 milliseconds, and here the right precordial leads that sit over the right ventricle, the most anterior portion of the heart, is 35 milliseconds, okay? And it's shorter in those right precordial leads because we have that thinner right ventricular wall. Now, as you may expect, these upper limits may be exceeded in the left if the left or right ventricle starts to hypertrophy, okay? And this is now because we have more mass for that impulse to get through. Hopefully that makes sense, okay? All we're saying is if the right ventricle starts to get thicker, okay, it may exceed that upper limit of 35 milliseconds, okay? All right, let's briefly review what we discussed before we end here. So the intrinsicoid deflection is from the beginning, the onset of our QRS complex, to the peak of our R wave. It represents the transmission from the Purkinje network in the endocardium to the epicardium surface directly under our electrode, okay? We said our Purkinje system all the way. This is the duration of it, okay? Through our endocardium, through our epicardium, and right to our electrode. That's the time we're measuring. Okay, the electrical impulse from the Purkinje system up until the electrode. Remember, we talked about these different timings where we saw in the left precordial leads, because of that thicker left ventricle, it's greater. The upper limit is 45 milliseconds, okay, just over one of the small boxes. And then here in the right precordial leads, V1 and V2, the upper limit is 35 milliseconds because we have a thinner right ventricular wall. All right. Well, that's the end of this lecture. We discussed intrinsicoid deflection, specifically what it represents and how it normally appears on the EKG. I hope you learned something.